Talking to your healthcare provider is the first step in managing migraine, and being able to communicate effectively about your symptoms and needs benefits both you and your healthcare provider. People with migraine often have to advocate for themselves to get the treatment they deserve. Properly preparing for a healthcare appointment is key to ensuring your concerns are addressed and your questions are answered. This is especially important when working with your healthcare provider to get a diagnosis or develop a migraine treatment plan. But where do you start when it comes to talking to your healthcare provider about migraine? A little preparation before your appointment can go a long way toward receiving the care you need. Establishing what you want and need to know before your appointment and learning how to talk to your healthcare provider will help you better advocate for yourself in the moment. Before you meet with your healthcare provider, make sure you are able to describe the quality and severity of your head pain. Pain levels are often assessed using a 1 to 10 pain scale or with the traffic light approach. Green means I can go. You can manage daily activities despite some discomfort. Yellow means I am slowed down. Your ability to function is reduced but not completely halted. Red means I have to stop. The migraine attack is debilitating, preventing you from continuing activities. Be prepared to discuss a range of different types of pain if relevant to your experience. Some common words used to describe the pain during a migraine attack include stabbing, throbbing, crushing, tingling, burning, sharp, pulsating, ice pick, pressure, constant, persistent. While head pain is a common symptom of migraine, not everyone experiences it during an attack. Migraine is unique for each person, so some people may have different symptoms of migraine than others. Be prepared to talk about any of these additional symptoms with your healthcare provider as well. Keep a migraine diary that documents your symptoms, triggers, eating and sleeping habits, and any current medications. Bring this diary with you to share with the healthcare provider during your visit. Organizing this information in one place helps your healthcare provider better understand your disease by giving them a complete overview of any behavioral, lifestyle, medical, or other factors that may be impacting your symptoms. This will also help you and your healthcare provider work together to determine the best treatment plan for you. Often people assume certain things trigger their migraine attacks. While migraine triggers are real and it is important to look out for them, some common triggers are actually just early symptoms of a migraine attack, which is called the prodrome phase. Be sure to talk to your healthcare provider about any foods, environmental factors, or other things that may trigger or increase your chance of an attack. The healthcare provider can help you identify which factors are triggers and which factors may actually be symptoms of an attack. Migraine is a hereditary disease. Look into your family's medical history to see if any relatives have also experienced migraine. If an individual has 1 or 2 parents with migraine, there is a 50 to 75% chance they will also have migraine. This can be very helpful in shedding light on your particular symptoms and getting a diagnosis. When you visit your healthcare provider, make sure to bring documentation of any medical records that may help paint a more complete and accurate picture of your migraine disease. This should include a list of all medications, including over-the-counter medications and treatments you've tried previously, including how you responded to each and any side effects you experienced. Additionally, bring documentation of all relevant medical tests you've already had performed along with a full copy of the results, if possible. Research your symptoms, triggers, and potential treatment plans ahead of time. This helps you better understand and contextualize your experiences with migraine so you can prepare to talk to your healthcare provider about potential treatments and ways to manage your symptoms. There is a full library of resources available at AmericanMigraineFoundation.org. It's not just okay to ask questions, it's encouraged. Get the information you need to understand migraine and how it impacts your life. Ask for explanations of any symptom-related issues or treatment options. Some questions you can ask your healthcare provider include: what can I expect from my treatment plan? What side effects can occur with this medication? Can non-medication treatments and supplements help? Above all else, communicate openly and honestly with your healthcare provider. Find a healthcare provider you can trust and feel comfortable with. Once you do, let them know you want to discuss migraine and treatment options. Open communication will help you and your healthcare provider collaborate to determine what is best for you. There are many different options to treat migraine, so it's important that you work with your physician to create an individualized treatment plan based on your preferences and medical profile.